Hormonal contraceptives, if you look in table 7.3, usually have a combination of either estrogen or progestin, or it could just have progestin only. Oral contraceptive pills have that combination of estrogen and progesterone. The mini pill has progestin only. The patch typically has a combination of estrogen and progestin. The shot is also known as Depo-Provera. Emergency contraceptives are called Plan B. They are most effective if taken immediately after having unprotected sexual intercourse, but can be used up to 48 hours. The longer out from the act it is, the less likely they will be effective. There's the vaginal ring, which is called NuvaRing, and implants, which are called Implanon. All these hormonal contraceptives, again, interfere with ovulation and maturation of a mature egg. Here's just a little cartoon on Depo-Provera. It's just not for birth control. Depo-Provera inhibits the secretion of pituitary gonadotropins in order to prevent maturation, ovulation, relax uterine and smooth muscle, and to restore hormonal imbalance. It can be used for endometrial hyperplasia, secondary amenorrhea, abnormal uterine bleeding, an adjunct or palliative treatment for endometrial or renal carcinoma, and pregnancy prevention. Depo-Provera is administered IM every 3 months, and there may be some transient menstrual abnormalities, meaning some breakthrough bleeding, and it may also cause edema, weight change, breast tenderness, nausea, fatigue, and depression in the patient. Objective 23, continuing on with that. Patient teaching for hormonal birth control, you should teach them ACHES. ACHES stands for abdominal pain, chest pain, headaches, eye problems, swelling or aching in the legs or thighs, and this is a mnemonic for the side effects of the birth control pill. Basically, these would be the signs and symptoms of either stroke or a venous thromboembolic event occurring. Also, with patients on hormonal birth control, they should use backup birth control if they're on antibiotics, and they should not double dose their birth control pills. Again, here is that acronym for ACHES. These are serious complications to birth control pills. Again, abdominal pain, chest pain, headaches, eye problems, and severe leg pain. IUDs is another form of contraception. It's prescribed by the healthcare provider. It provides good long-term contraception for somebody who is in a monogamous relationship that doesn't want to have another baby right away. The mnemonic here you teach the patient is pains, including a late period, abnormal spotting or bleeding, abdominal pain, pain with intercourse, infection or abnormal vaginal discharge, not feeling well, fever or chills, or the string that is missing or shorter or longer. Strings for IUDs should be checked every month after the menstrual period, and they should be of the same amount. There are some risks with IUDs, including uterine perforation, a pelvic inflammatory disease, and cramping and bleeding with the first few cycles following it being implanted. Sterilization. Sterilization is a 99.9% effective birth control for long-term use. This includes vasectomies in the males, tubal ligations in the females, and now there's a new product called Essure that we're going to watch a quick YouTube video on. Legal considerations for sterilization. The patient must be 21 years of age if using federal funding. There is a 30-day mandatory waiting period, and the informed consent must be in the individual's native language. Let's watch this Essure video.
Essure is a permanent birth control procedure that works with your body to create a natural barrier for pregnancy. The procedure can be performed in the doctor's office in minutes without going under general anesthesia. During this simple procedure, an Essure certified doctor places soft, flexible micro-inserts into your fallopian tube. No incision is needed because these tiny inserts are delivered through your vagina and cervix. The micro-inserts do not contain hormones and are made with materials that have been used in medical devices for many years. Over the next several weeks, your body forms a natural barrier around the micro-inserts that prevents sperm from reaching the egg. After 3 months, it's time to get an Essure confirmation test to verify you're protected from unwanted pregnancy. During this dental test, a doctor, usually a radiologist, introduces a special dye into your uterus that shows up on X-ray. This allows the doctor to confirm that the tubes are blocked and choosing a line serves the working plan.
So that's how Essure works, and it's been used in great success. It's done in the physician's office instead of undergoing a surgery for like a tubal ligation. Objective 24 says explain the mechanism of action for each method of family planning. Natural family planning does not involve the use of hormones or barriers. There's coitus interruptus, which is the withdrawal method. Again, it's not a very effective method. There's also fertility awareness, and there's lots of different types of fertility awareness, including periodic abstinence. There's the calendar rhythm method, the standard days method, the 2-day method, the ovulation method, the basal body temperature method, the symptothermal method, ovulation predictor kits, and the Marquette model. We're going to watch 2 YouTube videos over fertility awareness.
We're going to be looking at iCycleBeads, an app that works on the iPhone, iPod Touch, and the iPad. iCycleBeads is designed to help women plan or prevent pregnancy naturally, based on a highly effective and easy-to-use family planning method. To get started, the app will ask you for the start date of your most recent cycle. I'm going to go ahead and put in date of November 29th as our last period. Once you have that information in there, you click on Save. It then gives you the option to add additional history. We're going to skip this for now since it's not needed for setup. The first page you come to is a calendar, which is color-coded and tells us that today, December 8th, is cycle day 10, and that pregnancy is possible. If you wanted to find out more about what these colors represent, you would tap on the question mark key, and a color key will come up telling us that red represents cycle start date 1, or the first day of your period, brown represents days when pregnancy is unlikely, and white represents days when pregnancy is possible. You can also see this information in a CycleBeads format. CycleBeads is a color-coded string of beads that helps a woman to use this method. Many women like it because it gives them a very visual representation of their cycle. Again, today is cycle day 10, and pregnancy is possible. Another nice feature is that a woman will receive alerts. To see what alerts she will be receiving, she can check out the settings, and here she has the option to actually update the time, pick what time she might receive them, and turn them on and off. Now, the alerts will tell her things like if she's on the first day of her fertile window, if she's on the last day of her fertile window, when she might expect to get the next period, or if she's forgotten to input her cycle data, it will send her a reminder. Additionally, a woman might want to look at her cycle history. And to do that, she would click on the I button, which would take her to a page that shows the previous cycles. Now, we've only input 1 cycle so far, but if you wanted to add an additional cycle, if you put in, let's say, October 30th, and save that. And here, you can now see that our last cycle was 30 days long. We'll also have the dates of the last 2 cycles. This is information that a woman might want to share with her healthcare provider. Now, if you have questions about how to use this app, you can click on the Directions button, and all the information we looked at today will be summarized here. If you have questions more about the method and want to find out more about its efficacy, medical criteria for using it, what scientific basis and research behind it, you click on this About page. And finally, if you wanted to learn more about CycleBeads in general, you can go to the website, which is linked from the app, www.cyclebeads.com.
So that was about CycleBeads. So that was about CycleBeads, and like I said, there's an app for everything. So you should be able to find fertility awareness apps on your phone. The next one we're going to watch is over the symptothermal method.
Hi, this is Amelia from simplemsp.wordpress.com, Today I'm going to explain the symptoformal method of charting for natural family. This chart is from fertilityflower.com, and I'll do a review on them later. But this is a woman's 31-day cycle. The yellow line indicating your basal body temperature, which is set in the early morning before you get out of bed. You just have this on your basal body thermometer beside your bed and take this before you do anything. Then you would put that into your chart or write it down somewhere so you don't forget. And then the blue lines that are sticking up vertically indicate your vaginal discharge or mucus. So I'm going to explain really quickly the 4 rules of symptoformal method. The first rule is that the first 5 days, which is your period, in which your uterine line is discharging, you're completely safe. And it's up to you and your spouse to see what you have in your hormonal phase. But those days you're completely safe. And then day 6, 7, 8, 9, 10, 11, and 12, this woman did not have any cervical mucus. So those days she was completely safe to have intercourse. That's called the dry day rule. That's rule number 2. So we have the first 5-day rule, dry day rule, and then number 3 we have the temperature shift rule, stating that you're safe to eat on the 3rd consecutive day that your temperature is above the cover line, which is that horizontal purple line right here that's at 97.6 degrees Fahrenheit in this example. And this woman's ovulation occurred on day 17, and that's indicated by this vertical purple line on day 17 with the highest cervical mucus. Her temperature shift is very obvious. It jumps to above 98 from being at 97.2. So that's a very large shift. And the 3rd consecutive day that you are above that cover line, you're safe because your ovulation has been confirmed. And then number 4 is the peak day rule, that you're safe the 4th consecutive day after your peak day. So that would again be day number 20, which would be the 3rd day above your cover line. And that you would be safe the evening of that 3rd day, just to be sure that the temperature shift is above. You would want to wait to be positive. And this method works. It's good for about 99.4% of people. It works. Some people have problems, and that's something you'll have to assess with your spouse as to whether or not this method still works for you. But it's worked for a lot of people, and I think you'll find it very helpful. And if you have any other questions, go ahead and leave a comment or send me an email. And you can find lots of.
So any of these can be used for natural family planning. Again, here's cycle beads, and again, like I said, you watch the video over the eye cycle beads, and these beads are often used again to tell fertile windows. This is a picture of a symptothermal chart. Again, this one's just the basal body temperature chart. This one's a symptothermal chart because it does have the symptoms including the temperature, the mucus, the cervix, and the cervical os opening. Here are some examples of some ovulation predictor kits looking for the spike in luteinizing hormone. Ovulation kits look for luteinizing hormone.